Morning Show.
It was 2 years ago today that our family tragically lost my son, Brandon Smiley. And as we continue to grieve his loss, I wanted to bring some awareness to the opioid crisis that's going on in our community and taking our young people out at alarming rates. We got the one and only Dr. M.J. Collier on with us this morning. Dr. Collier, good morning. Happy to have you, and thank you for jumping on with us.
Good morning, Rickey, Smiley. And again, so sorry for your loss. We celebrate Brandon and continue to do so because at least this tragedy is bringing us an opportunity to inform people and give people knowledge on how to avoid this situation. So, Rickey, it's a serious topic today. We're going to talk about the epidemic of drug addiction and deaths due to overdose. So people often ask me, I had this question yesterday, well, why do people just not take drugs and just they don't understand? The problem is, you have a physiologic addiction, and that's to some drugs like crack cocaine, immediately one dose, and now you're physiologically addicted to it. Your body wants it and sometimes even needs that drug, so you just feel natural or normal. And then there's a psychological addiction, where there's just a compulsion to take the recreational drug. People, if it makes you feel good, if it gives you energy, opioids make you feel good. Stimulants like cocaine give you energy and make you feel like you can do more than you normally do. People like that feeling, and so they want to continue to feel that way. So, Rickey, in 2003, deaths from drug overdose were only 8.9 per 100,000 people. But by 2022, this is right during the COVID era, the rate increased to 32. But that's a full four-fold increase in deaths from opioids. So this is when we really started to define this as an opioid crisis. But guess what, Rickey? In the last 2 years, the rate has declined, especially in people aged 15 to 54. Now, this is mostly due to increased use of a rescue medication called Narcan, because the use of narcotics has not gone down. People are still using them and using them probably more. But we have this rescue medication Narcan that's now, it used to be difficult to obtain, but now it's readily available. EMSs have it, teachers have it. It's available in a lot of buildings and offices. So if a person is overdosing, you take this and anybody can do it. It's an activated nasal spray. You stick it in one nose, you hit a button, and boom. And within 30 seconds, the person comes back. And so that has been credited for saving a lot of lives. And so we are glad that is readily available. And so if you do not have Narcan in your work environment, then people need to make sure that they're capturing it.
Dr. Collier, we hear a lot about fentanyl in the news. What is it and why is it so deadly?
Okay, so fentanyl is a synthetic opioid that is so deadly because it's so potent. And what happens is that people take it at the same doses that they would other opioids, and it's far too much for them. There have been cases of people just their skin being exposed to fentanyl from handling the product or touching bags with it or whatever, and they absorb enough through their skin, it decreases your respiratory rate. It stops you from breathing. So when that happens, of course, you can't be saved. You're just not breathing. You turn blue and you basically suffocate. So that is a big problem. What I don't understand, and this is up for discussion, is why a lot of people who sell drugs are adding this to their product. Even marijuana, it will be contaminated with fentanyl, and so you're really, killing your market. So I don't understand why people do that, whether they're, trying to do that maliciously, or whether they just want to, say my product has a little more kick to it, but they're not really understanding what they're doing when they contaminate, routine drug use with fentanyl.
And they putting it in vape also. I'm talking about pills, marijuana, heroin, vaping. Let me ask you something. Is it possible to have an addiction and not even know it? And is addiction hereditary?
The susceptibility to addiction is hereditary. So it's like when you have a lot of alcoholics in the family, and people say, well, I don't drink alcohol because my grandfather was an alcoholic, my father was an alcoholic, they were addicted to the alcohol. So the same thing, if, you're made from the same building blocks, so you're genetically predisposed to maybe have a strong attachment to a certain product by the receptors, the opioid receptors that are in everybody's body. That's what responds to the the thrill, the pain relief, whatever people are taking the opioids for. Some people bind stronger or are just more susceptible to it, or they just like it more.
Dr.
Right.
Collier, we hear so much about accidental overdoses. Is there a way to look at a pill and determine if it has fentanyl in it or not?
No, that's the problem. You never know what you're taking. So, one, you want to make sure that if you're taking opioids, that they are prescription drugs that should have some quality controls to them. Not obtain opioids from a friend, or somebody just say, oh, they had these pills, and I just wanted to try it, or I was having some back pain, so I borrowed some medication, some Percocets or something from a friend or a relative. Don't do that, and definitely don't buy them, from the street, pharmacist. So anybody that's offering you anything that is not a medical professional, you have to question again what's in it, the quality of it, what's it contaminated with, and that's the biggest problem. Again, these vapes have made it very easy for younger people to partake because the vapes don't have as noxious an odor or smell, so they can utilize those in the school environment without getting questioned or caught. So this is a big problem, and the contamination. I don't know. People just making anything. Nobody really knows the science. It's not. At least in the earlier days, drug dealers had formulas that they would utilize to have a quality product that was consistent. Everybody knew what was in it, and everybody knew the amounts that was in it. That is totally out of the window now, and people are just making up anything just to get it on the street and sell it.
Yeah, Dr. Collier, like my mom say, and I heard them say in her recovery program all over the years, some have to die in order for others to live. And, it's January the 29th. We just can't sit here and talk about it. My first mindset was to stay in bed and just not deal with it. But I just think that we should talk about it, and maybe we could save somebody's life today and bring some awareness to somebody, to save their life, because I don't want to see other parents go through what what we have went through. And coincidentally, we're going to bury Uncle Bruce Friday. Uncle Bruce passed away. It's like, everybody know Uncle Bruce. He's Anthony Bruce Smiley. He's been on this morning show many times. He always had the birthday beach blowout. And so we're just dealing with a lot this week. But, we just thank God for people like you, Dr. Collier, and other people out there at all of these facilities that's trying to save people's lives, and everybody in NA and AA and all the Narcotics and Alcoholic Anonymous program. Dr. Collier, let everybody know who they can contact if they have anybody struggling with addiction, and a number or a website that people could go to.
So all of those organizations that you just mentioned, particularly AA, Narcotics, NA, and AA, are very good sources and resources. They are available in virtually every community. And then there's a new organization, findtreatment.gov, findtreatment.gov, that you can go to on the internet that will refer you to local resources that can help. Because, Ricky, one of the other things I wanted to mention was that the death rates actually are increasing in people older than age 55. So younger people, the death rates have come down mostly because of use of Narcan, not decreased use. But in older people, and you know why? Prescription opioids. Prescription opioids. They're getting prescriptions from the doctor, and they're getting too much. They're taking too much. They figure if one pill is good, then two must be great. And despite all the rules, regulations, when people get a medication prescription for an opioid, they have to have a drug toxicology screen. They have to have counseling. There are all these safety rules and regulations in place. Yet people still are dying at a higher rate, age 55. And this is, imagine losing your parent or grandparent to an opioid overdose, which is as tragic as losing a child. Of course, nobody wants to outlive your children, no matter what the cause of death is. But, again, we have to think about the older people. This is happening to them as well. So this is a across-the-board epidemic. I would even say a pandemic that we're having to deal with now. And so we want to make sure that you, again, only get your prescriptions from a certified medical professional who will counsel you, monitor you, and make sure that you're getting the relief that you need. Some people do need pain medications that are in the opioid class because they're hurting. They got broken bodies, so that's the problem.
And thank you so much, Dr. Collier, man. We really appreciate having you, man. Thank you for addressing this issue. It's a tough issue. We have to talk about it, and hopefully that somebody's life change or is saved today, because we are living in dangerous time. Yes, sir. Dr. M.J. Collier.